Thinking about the food or hearing about it or even seeing the food will result in secretion of saliva. What glands are responsible for this? Salivary glands. And these salivary glands will form an important component of the digestive system. Even though they are an important component, the anatomy of these glands is often neglected. They are not only important because they are an integral part of the process of digestion, they are also clinically important. In this image, what we see is a clinical condition referred to as mumps, characterized by swelling of one of the salivary gland, that is parotid gland. This condition usually affects neonates or infants, and it is extremely painful. The reason for that, it has an unyielding capsule and rich sensory innervation. In order to understand the anatomy of this innervation, we need to know the detailed anatomy of the parotid gland. And in this session, let's focus on the anatomy of the parotid gland, and we will also learn about one of the important clinical condition associated with that is Frey's syndrome. Let's begin with the learning objectives. The learning objectives for this session are, at the end of completing this session, you should be able to describe the boundaries of the parotid region where the parotid gland is situated. Then you should be able to describe the parotid gland under these following headings. First is of course the location, which is parotid region. Then you need to describe its coverings, presenting part and relations, structures which are present within the parotid gland, then anatomy of parotid duct, its blood supply, nerve supply, lymphatic drainage, and finally the clinical anatomy of parotid gland. Let's begin with identifying the boundaries of the parotid region. Why exactly it is called as parotid region? Otid refers to the ear. So this is a region which is present around the ear. The parotid region has the following boundaries. Above by, this is the upper boundary. It is formed by what? The zygomatic arch. Then anteriorly we have the ramus of the mandible, which is covered by the anterior border of masseter muscle. So here we have the ramus, and the ramus is covered by the masseter muscle. Posteriorly we have what? This is the mastoid process. This is the mastoid process. This is how the parotid region is bounded. And what we have medially, since we have the parotid gland covering, we cannot see the medial structure. But remember, medially we will have a process. And what is that? The styloid process. These are the boundaries of the parotid region, right? Apart from this, we also have something referred to as parotid bed. We will see about it later. What is parotid gland? Parotid gland, remember, is the largest of the salivary glands. It is the largest salivary gland. And as we know, it is a paired gland. We have two salivary glands on either side of the external ear, right? It is the largest of the salivary gland, measures about 25 grams in weight. It is pyramidal in shape, appears pyramidal in shape with the base directed towards the external ear and apex directed towards the neck region. The parotid gland is situated in a mold created by bones and muscles, and we refer this region as the parotid bed. Now let's try to understand what exactly is the parotid bed. Remember, the parotid bed is formed anteriorly by the ramus of the mandible. So we have the ramus of the mandible. Then we have the mastoid process posteriorly. Then we have the external acoustic meatus above, and medially we have the styloid process. This is covered by lot of muscles. What are they? Medially, on the deeper aspect, we have the medial pterygoid, and then we have the outline of the masseter muscle, right? And posteriorly we have what? We have the sternocleidomastoid, and arising from the deeper aspect of the mastoid process, we have the posterior belly of digastric. All these structures together, for example, Anteriorly, the ramus of the mandible covered by the muscles. Posteriorly, the mastoid process giving origin to sternocleidomastoid and posterior belly of digastric. Above the external acoustic meatus, and medially the styloid process with the styloid group of muscle. These are the structures which will form a mold for the location of the parotid gland, and this is what we refer to as parotid bed. If we write the location of the parotid, this is how the parotid gland will be located over these structures. Right? This is little bit regarding parotid bed. Remember, parotid bed and parotid region are slightly different. This is regarding introduction to the parotid gland. Once we have learnt about this, let's try to understand what about the capsule or covering of the parotid gland. As we said, the parotid gland is situated below and slightly in front of the ear, and it is covered by a capsule, and this capsule is formed by the investing layer of deep cervical fascia. It is formed by the investing layer of deep cervical fascia, which is the most superficial layer of the deep cervical fascia. Close to the apex of the gland, the investing layer splits into a superficial lamina. This is known as the superficial lamina and a deep lamina. Right? I'll just repeat again. The investing layer of deep cervical fascia close to the lower pole or apex of the parotid gland splits into a superficial layer and a deep layer. The superficial layer will cover the superficial surface of the gland and will ultimately get inserted to the lower border of zygomatic arch. Importance of this superficial layer is, remember, this layer is very tough. It is tough and unyielding. And it also has rich sensory innervation. Why we need to know all this? Because of this tough, unyielding nature and rich sensory innervation, the swellings of the parotid will be extremely painful because this superficial lamina cannot stretch. Remember, this is the cause for extreme pain even in mums. What is that? The tough, unyielding nature of the superficial lamina or anterior part of capsule of the parotid gland, along with the rich sensory innervation it receives from the auriculotemporal nerve. Right? Then, what about the deep lamina? The deep lamina is comparatively thin. It is comparatively thin, and posteriorly it is attached to two structures. One is the styloid process and the other one is the tympanic plate. This is what you need to remember regarding the coverings or capsule of the parotid gland. This can be asked even in exams, right? The cause for the extreme pain which can occur in parotid swellings. Remember, it is because of unyielding nature of the anterior part of the capsule or the superficial part of capsule, which is formed by the investing layer of deep cervical fascia. Right? This is regarding the capsule. Then what about the presenting parts? Right? This diagram is actually showing the section of the parotid gland. We will write the profile view of the parotid gland. Let's imagine the outline of the parotid gland looks something like this. As I said, it looks like an inverted pyramid. Right? So this parotid gland will have the following boundaries. It will have a base which is directed towards the external ear. This is the part that is present below the ear. So you can call this as base. The lowermost portion is conical and we can refer this to as the apex. Right? Then we have this border which can be referred to as anterior border, and this is the posterior border. Right? On the deeper aspect, there is one more border which runs and separates two surfaces. And what would be this border? This is referred to as the medial border. Fine. So we identified the base, Then we identified three borders: anterior, posterior and medial. Then there is an apex. Along with this, there are three surfaces. The surfaces can be best described in this section. Let's try to identify the surfaces. This is the region of skin. So what we have here is, this is the superficial surface, right? This is the superficial surface. Then this surface is referred to as the anteromedial surface, and this surface is referred to as the posteromedial surface. We can identify all the three borders here. What are they? Here we have, this is the anterior border, this is the posterior border, and we can say this is the medial border. Right? This is regarding the presenting parts of parotid gland. Let's summarize it now. The parotid gland will have a base, an apex, three borders and three surfaces. Remember, sometimes the base is also referred to as the superior surface. Fine? The base can be also referred to as superior surface. This is regarding the presenting parts of the parotid gland. Let's see about the details of this now. What about the important relations of this gland? Now, as I said, the base is also referred to as what? It is referred to as the superior surface. If we observe, there are few important structures which are emerging from the base or the superior surface. What are these? These vessels are superficial. These are superficial temporal vessels, artery and vein. And what is this nerve? This is the auriculotemporal nerve. Right? This is the auriculotemporal nerve. Then we can see structures emerging from the anterior border and structures emerging from the posterior border. Now let's try to understand what are these. Structures emerging from the anterior border, the most important structure is this. What is it? This is referred to as the parotid duct. This is the parotid duct, right? Then above the parotid and below the parotid, we can see few more important structures. Now let's see what are these. This is the temporal branch of facial nerve. This is the temporal branch of what? Facial nerve. Of facial nerve. This is the transverse facial artery, a branch of superficial temporal artery which supplies parotid. Then we have the zygomatic branch of facial nerve, and then we have the buccal branch. Usually on either side of the parotid gland, we will have two buccal branches coming from facial nerve. Then here we have what nerve? This is the marginal mandibular nerve. This is known as the marginal mandibular branch of facial nerve. These are the structures related to anterior border. In the next image, we will try to understand what exactly is the meaning of anterior border. But remember, anterior border is directed towards the cheek, and these are the structures which will emerge from anterior border. Most important structure, parotid duct. Above and below parotid duct, these are the structures emerging from the anterior border. Similar to this, if we see the posterior border, what we have here is, these are the posterior auricular vessels. Then we have the posterior auricular nerve. Right? Posterior auricular nerve is again a branch of facial nerve. Then posterior auricular vessels come from external carotid artery. This is regarding the posterior border. Then even from the apex, we can see that there are few structures emerging. What are these? Now these are the two branches coming from retromandibular vein. Fine. So these are the two divisions of retromandibular vein, and then we have the cervical branch. Right? So this is regarding the structures that are related to the base of the superior surface, then we have the apex, we have the anterior border, and then we have the posterior border. Right? Once we have learned this, let's focus on the surfaces now. Along the surfaces, we have the borders. Now let's try to identify the borders. This is what we refer to as anterior border. This is the posterior border. And what we have here is, this is the medial border. Right? So what is anterior border? In order to do this, we need to identify surfaces. The surface towards the skin, what is this? This is the superficial surface. Right? Then, between the anterior and medial border, whatever surface you have, you call this as anteromedial surface. Right? Similarly, the surface between the medial border and the posterior border, this surface is referred to as what? Posteromedial surface. This is how we identify the surfaces and borders. Let's try to identify the relation of each of these surfaces now. Let's begin with the superficial surface. The superficial surface initially has skin, then it has superficial fascia, then it has the capsule, and within the substance of the parotid, we can identify the parotid group of lymph nodes. These are the four structures that are related to the superficial surface. Right? What are they? We have the skin, then we have superficial fascia, followed by the capsule, and then the parotid gland. Then what about the anteromedial surface? As we can see, anteromedial surface has the ramus. On either side of the ramus of the mandible, we have two muscles. On the external surface, what is this? This is the masseter muscle, whereas this is the medial pterygoid. These are the structures that are related to the anteromedial surface. Similarly, when we come to the posteromedial surface, we have one more bone here. What is this? This is the mastoid process. Then we have two important muscles. This is the sternocleidomastoid, and here we have the posterior belly of digastric. Posterior belly of digastric. Right? Apart from this, we have one small bone here with three muscles. What is that? Remember, this entire thing is what we refer to as the styloid apparatus. Right? What is styloid apparatus? We have the styloid process with three muscles: styloglossus, stylohyoid, and stylopharyngeus. This is regarding some of the structures which are related to the posteromedial surface. Apart from this, we can also see two large blood vessels. Now, what are these? This is internal carotid artery, then this is internal jugular vein. And we see those four yellow colored dots, right? These represent the last four cranial nerves: glossopharyngeal, vagus, axillary, and hypoglossal. The one in front is the hypoglossal nerve. The three nerves which are present at the back, these are glossopharyngeal, vagus, and axillary nerves. This is regarding the external relations of the parotid gland. One more important relation we can observe here is few structures which are present within the parotid gland. We have a nerve, vein, and then artery. We will see what these are. As I said, the parotid gland will have few structures inside it. The most important structure is the facial nerve. What you see here is, this is the trunk of facial nerve. Right? The facial nerve trunk will divide into two divisions. What is this? This is known as the temporofacial trunk. This is the temporofacial trunk. And what about this? This is the cervicofacial trunk. The presence of the facial nerve within the parotid gland will divide the entire parotid gland into two parts. The part that lies superficial to it is also referred to as the superficial lobe of the parotid, whereas the part that lies below it, this is referred to as the deep lobe of parotid. the plane along which this division occurs, it is also referred to as Patty's plane. Patty's fascio-venous plane. This is the plane along which the facial nerve will divide the entire parotid gland into a superficial lobe and a deep lobe. So this is the most superficial structure that is present within the parotid gland. Deep to the facial nerve lies retromandibular vein. Okay, so remember, the structures present within the parotid gland are 3 in number. First, we have the facial nerve. Second, we have retromandibular vein. And third, we have the external carotid artery and its terminal branches. So remember, these 3 are the important structures which are present within the parotid. From superficial to deep, these are facial nerve, as we saw just now. Deep to facial nerve, there is retromandibular vein. Then, deep to retromandibular vein, we have the external carotid artery terminating into superficial temporal and maxillary arteries. So, these are the structures which are present within the parotid. Very often asked as a short answer or a 3 marker. Once we have learnt about the relations of the parotid gland, let's focus on the anatomy of parotid duct. Again, one of the frequently asked questions in your university exam. Parotid duct is also referred to as Stenson's duct. It is referred to as Stenson's duct. The entire length of the parotid measures about 5 centimeters. Parotid duct is responsible for carrying secretions from the parotid gland into the oral cavity. The course of the parotid duct can be studied using these diagrams. As we can see, the parotid duct courses over the anterior surface of the masseter muscle. We can see the same here. The duct, after it arises from the middle of the anterior border of the parotid gland, rests on the anterior surface of the masseter, and at the anterior border of the masseter, it takes its first bend. Right? Remember, this is the first bend of parotid duct. Once it bends here at the anterior border of masseter, it pierces one important structure. This is the buccal pad of fat. This is the buccal pad of fat. Right? Then, if you observe, it is piercing one green colored structure. What is that? This is the buccopharyngeal fascia. It is the buccopharyngeal fascia. Then we have the buccinator muscle. Now this is one commonly asked question in your university exam as well as Viva. What are the structures that are pierced by the parotid gland? Remember this as 3 B's. What are they? The buccal pad of fat, that's the first structure. Then we have the buccopharyngeal fascia, and finally we have the buccinator muscle. These are the 3 B's that are pierced by the parotid duct. Fine. Once it pierces the buccinator muscle, it takes its second bend. This is the second bend. After that, it passes horizontally over the deep surface of the buccinator muscle, and then what happens is it takes its third bend. Now where this third bend occurs? This third bend occurs at the level of the crown of the upper second molar tooth. At this point, the parotid duct will open into oral cavity. So remember, throughout the course, the parotid duct will take 3 bends. You need to know where exactly these 3 bends occur, what are the 3 B's that are pierced by the parotid duct, and ultimately where is the opening. So remember, this opening is at the crown of upper second molar tooth. Right? This is regarding the anatomy of the parotid duct. Right? Fine. Once we have learned this, let's focus on the nerve supply. The nerve supply of the parotid gland can be read and learnt under different headings. First, we'll try to understand how exactly the secretions of the parotid salivary gland is controlled, and this is controlled by the secretomotor pathway. The secretomotor pathway. The secretions of the parotid gland are controlled by a nucleus referred to as inferior salivatory nucleus. Inferior salivatory nucleus. This nucleus is present in the medulla oblongata. Fibers from the inferior salivatory nucleus will ultimately go to glossopharyngeal nerve. Glossopharyngeal nerve, which is the 9th cranial nerve. Then the fibers leave the glossopharyngeal nerve through the tympanic branch. Tympanic branch of the glossopharyngeal nerve. This nerve is also referred to as Jacobson's nerve. Right? It is referred to as Jacobson's nerve. The tympanic branch ultimately will form a plexus referred to as tympanic plexus, where the tympanic plexus is formed over the external surface of tympanic membrane. Right? From this, there is a lesser petrosal nerve. So we have the lesser petrosal nerve. The lesser petrosal nerve ultimately relays into a ganglion. Fine? And what is that ganglion? That is the otic ganglion. Right? This is how the preganglionic secretomotor fibers will arise from inferior salivatory nucleus and reach the otic ganglion. From the otic ganglion, we have the auriculotemporal nerve. The fibers will pass through auriculotemporal nerve, which is a branch from posterior division of mandibular nerve. Auriculotemporal nerve will ultimately supply secretomotor fibers to the parotid gland. This is how the secretions of saliva is controlled. The fibers from inferior salivatory nucleus will reach ultimately the parotid gland. This is how you can represent the secretomotor pathway. Then, what about the sensory innervation? What about the sensory innervation? The sensory innervation, remember, it is from the same auriculotemporal nerve. Fine? So, auriculotemporal nerve carries two types of fibers to parotid. One is the sensory fibers and the other one is secretomotor fibers. In addition to this, we will also have vasomotor fibers which are supplying or innervating the blood vessels of the parotid. This is again derived from otic ganglion, but the fibers are sympathetic fibers coming from superior cervical ganglion. Right? So this is how you can represent the innervation or nerve supply of the parotid. Secretomotor, sensory and vasomotor. Right? Yes. Once we have learnt about the innervation, what about the blood supply? The blood supply of the parotid is mainly from two arteries. What are these arteries? The superficial temporal artery. What we have here is, this is the superficial temporal artery, and one branch coming from superficial temporal artery, that is transverse facial artery. These two arteries will supply arterial blood to parotid gland. So remember, superficial temporal and then transverse facial artery. Then, what about the lymphatic drainage? The superficial surface of the parotid gland has the parotid lymph nodes embedded in it. Right? So the lymphatic drainage is into these parotid group of lymph nodes. From the parotid group of lymph nodes, the lymph can ultimately drain into the deep cervical nodes. So the lymphatic drainage is first into parotid nodes. Where the parotid nodes are situated? Parotid nodes are situated in the anterior or superficial surface of the parotid gland. Then from here, the lymph can go to deep cervical nodes. Right? This is regarding the lymphatic drainage of the parotid gland. Then what about the clinical significance or clinical anatomy associated with the parotid gland? What we see in the image is an inflammatory condition of the parotid gland, which is usually seen in children. This condition is referred to as mumps. This is a viral infection affecting the parotid glands. Results in enlargement of the parotid gland, which would cause stretching of the capsule. And as we discussed earlier, this is a severe, painful condition. Now, why there is severe pain? As we have described earlier, during the discussion of the capsule, enlargement of the parotid gland would cause stretching of the superficial part of the parotid capsule. And because of the tough, unyielding nature of the superficial lamina of the capsule, and also because of rich sensory innervation by the auriculotemporal nerve and also the greater auricular nerve, this results in severe pain. This is one important clinical condition that you want to remember while mentioning the clinical anatomy of the parotid gland. Then, apart from this, we also have a clinical condition referred to as Frey syndrome. We refer this to as Frey's syndrome. It is also referred to as gustatory sweating. Gustatory sweating. Now, why it is called as gustatory sweating? Remember, this is sweating occurring while eating. What exactly happens in Frey syndrome? The people with Frey syndrome will have secretion of sweat over the region of parotid. That is, skin over the parotid will become red and there will be extreme sweat secretion. And this occurs particularly during eating a meal. Why this occurs? Remember, the secretomotor supply to parotid gland is by which nerve? So, secretomotor nerve supply is from the inferior salivatory nucleus, right? And it reaches the parotid gland through ultimately auriculotemporal nerve, right? So, auriculotemporal nerve is concerned with carrying the secretomotor fibers to the parotid gland. Similarly, the skin over the parotid gland is innervated by, remember, the skin over parotid is innervated by the greater auricular nerve, right? It is supplied by great auricular nerve. The function of greater auricular nerve is they receive cutaneous innervation from the skin over angle of the mandible and over the parotid. In addition, they also supply pseudomotor fibers to the skin covering parotid gland. What is the function of these pseudomotor fibers? They innervate sweat glands. So, stimulation of greater auricular nerve will also result in secretion of sweat over the parotid. In case of injury to auriculotemporal nerve, during regeneration, what happens is some of the fibers that are destined to go towards the parotid gland. Instead, what they do is they go towards this pseudomotor glands, that is sweat glands. So, secretomotor fibers from the inferior salivatory nucleus, instead of innervating the parotid gland, they innervate the sweat glands supplied by greater auricular nerve. So, every time there is eating, every time we eat, instead of salivary secretion, there is secretion of sweat over the skin covering the parotid gland. This is the reason why we refer it to as gustatory sweating. This is the anatomical basis for Frey syndrome. Right? Fine. Once we have learnt about Frey syndrome, let's try to quickly summarize now. Parotid gland is the largest of the salivary gland and it is in the shape of an inverted pyramid. It has got a base, it has got an apex, then it has got an anterior border, this is the anterior border, then we have the posterior border. Along with this, there is a medial border. Then we have three surfaces. This is the superficial surface, then we have the anteromedial surface, and then we have the posteromedial surface. We discussed about structures emerging from the base, apex, anterior border, posterior border, and the important structures related to the surfaces, superficial, anteromedial, and posteromedial. We discussed about the details of secretomotor innervation to parotid, which is from inferior salivatory nucleus. The preganglionic fibers arise from inferior salivatory nucleus, pass successively through glossopharyngeal nerve, its tympanic branch, then the tympanic plexus and lesser petrosal nerve to reach the otic ganglion. Postganglionic fibers from the otic ganglion will ultimately reach the parotid gland through auriculotemporal nerve. When these secretomotor fibers get misdirected and enter into greater auricular nerve, this can result in a clinical condition referred to as Frey syndrome. So we discussed about the details of anatomical basis of Frey syndrome. Apart from this, the blood supply of the parotid gland is mainly from the superficial temporal artery and its branches, and the lymphatic drainage is into parotid nodes, and from the parotid nodes it goes to deep cervical nodes. One of the clinical condition affecting the parotid gland, especially in children, is mumps. Now this results in severe pain. The reason for severe pain, unyielding nature of the capsule. The superficial lamina of the capsule of the parotid gland is unyielding and has rich sensory innervation, which results in extreme or severe pain during swellings of parotid. This is regarding the detailed anatomy of the parotid gland and the anatomical basis for Frey syndrome. That's it for this session.